Okay, thanks for joining us today on my webinar. This webinar today is about back pain, and big three things I want to go over today is what are the common causes of back pain, how back pain is often treated, and my approach to treating back pain. So thanks for joining us. Let's get started. First of all, to give you guys an introduction of myself, my name is Dr. Clayton. I am a second generation chiropractor. My father's been a chiropractor for about 30 years now, and I over the years saw the benefits and help he was able to give people in the community, and really wanted to make a difference myself, and that's what really brought me into this profession. I'm happy to be helping people. Okay, why is it important to have a webinar about back pain? Well, 80% of Americans at one point in their life will have significant back pain, and we spend about $50 billion a year on treating back pain in this country, so a very significant problem in our country. What are some of the common causes of back pain? You know, everyone's different. Everyone has different things that cause their back pain and lead to back pain. That's why it's really important to have a thorough examination done of the back to find out what caused your pain. But let's go over some of the common causes. One of the big problems is core muscle strength. If we don't develop a good core muscle strength, our back is really vulnerable to being injured. Okay, so when we have weak core muscles, this often leads to biomechanical changes, or in other words, changes in the way our body functions, the way we move, the way our joints all function. When we get these changes, and they're compounded with a lot of other factors, including bad posture, maybe we have a bad mattress that we're sleeping on, maybe it's what we're doing at work, lifting improperly, hunched over a computer, all the different things, the stress that we put on our bodies and our lives build up, and when we don't have the muscle strength to protect that area, it all compounds and changes the entire way we function. It changes our mechanics, and often that's one of the causes of back pain. So this is the start of what I like to call the chronic pain cycle. Now let me explain the chronic pain cycle here. I'll show you what I'm talking about also here. Chronic pain cycle is when our bodies stop functioning properly. The body tries to protect itself from injury by having the muscles tighten up and kind of lock down that area. Now, of course, this will lead to more biomechanical dysfunction, or the body just won't be moving better. It'll be actually moving worse now. And this causes the muscles to even tighten up more to help protect itself. And this kind of leads to a vicious cycle that eventually starts turning into a lot of pain. Okay, so those are some of the common causes of back pain that we have. There's also other things like workplace, car accidents. These things really accelerate the pain and the chronic pain cycle. And once again, where those muscles really lock down that area and the pain and dysfunction kind of sets in. Okay, now that we've talked about some of the common causes of back pain and what's going on there, let's talk about how back pain is treated in our country. So I'm going to go to WebMD. Let me show you this here. WebMD says that we should use ice, aspirin, or non-steroidal anti-inflammatory drugs to reduce inflammation, and we should use prescription pain medication if the pain gets worse, and if it's still not getting better, refer for pain injections. Okay, that looks like a pretty typical treatment for back pain from what I've heard from other people, where you go into the doctor, they're going to give you pain medicine. If it's really bad, they're going to give you prescription pain medicine. After that, their next step would be the injection shots to kind of reduce pain. Now, keep in mind here that this is just blocking the pain signal. It's not really addressing any of the problems that we've talked about with back pain. It's not going over the chronic pain cycle. It's not going to fix the underlying problem. It's just going to get people out of pain. So I like to compare that type of treatment to a smoke detector. If we have a smoke detector in our house and there's a fire, it's going to sense that there's a fire and set off the alarm. The alarm tells us that there's something wrong. Same with our backs. When our backs have a lot of problem, when it gets in that chronic pain cycle, we have the signal and the alarm going off, and that's the pain to tell us there's something wrong. Well, if we take the medical approach, what we'd really be doing is taking the batteries out of the smoke detector and cutting off that signal. But that would not prevent us from having a fire in our house. Now, the same thing with our backs. If we take the pain medicine and the pain goes away, we might be feeling better, but that doesn't mean we fix the underlying problem of the back pain. Okay, one last thing about the typical treatment for back pain in this country. They did a survey in 1999, I'll show you here, and this was of medical doctors that focused on treating musculoskeletal conditions. And only 31% of these doctors felt adequately prepared to treat back pain. Instead of just blocking the pain signals that are coming from your back, as a chiropractic physician, what I like to do is find the underlying cause of your back pain and address that. one of the first approaches I take is to start by addressing some of the pain. People don't like to be in pain. We want to be out of pain. A lot of different modalities, therapies we use to get people out of pain. We do massages, we do some instrument-assisted massages, we do ultrasound, we do the electrical stimulation, we do hot packs, ice packs. We have some natural whole food supplements that we use to help people get out of pain, because no one wants to be in pain. But we also start off right at the beginning with focusing on the dysfunction in your back or the cause of your low back pain. And after 8 years of college as a chiropractic physician, that's one of the things I've trained to do, is find the different spots in your back that have the problems, the dysfunction, where things aren't moving the way they should, and through spinal manipulation, or we call it adjusting, restore proper biomechanics or the mechanical movements of your back, and to get it moving right. We also work on muscles. We calm the muscles down, and after we restore proper function, the body in a natural way gets out of pain, and we start breaking that chronic pain cycle. Now, once all that's done, it's really important that we start focusing on some physical therapy exercises. We want to start strengthening our core muscles to prevent future injuries. So we're not only addressing the underlying cause of your back pain, we're also fixing it and hoping to prevent future injuries. If you're ready to get out of back pain and you want to address the underlying causes of the back pain, not just masking the symptoms, then go ahead and download this coupon here. This is only available until the end of the webinar, but I'd really like to get you in and show you how we can help you with your back pain. Okay, some of you have been asking today, well, will this work for me? How do I know chiropractic will really help with my back pain? And some people have been asking, well, is chiropractic safe? And I want to go over a couple of those here. So let me show you a few studies. We're going to go over a few of these here. All right, first thing I want to go over here is the American College of Physicians. They came up with clinical practice guidelines. Now, these guidelines are based on the highest quality evidence, and they should be used by physicians everywhere. Now, they're designed for all different types of conditions, and they give you guidelines of what the research shows we should do to treat that. And so the clinical practice guidelines for treating back pain include chiropractic spinal manipulation or the adjustment, and medication was not shown to be an effective treatment for treating back pain, which that kind of surprises me, since the typical treatment that we're doing every day is medication to mask our symptoms. But the physicians should be reading their own research with clinical practice guidelines and addressing it with spinal manipulation. Now, the next study came out in 2010 in the Spine Journal, and this showed that chiropractic manipulative therapy, or the adjustment, had greater improvements with back pain compared to typical physicians' treatments. And we've talked about the typical physicians' treatments, where people are getting the pain medication or prescription medication or injections. And this study showed that the chiropractic manipulation was much more effective than that. In 1990, they did a survey to find out how many people were going to chiropractors. And what they found was there was about 140 million visits during that year to chiropractors. 7 years later, they did a follow-up study to see if the numbers had gone up or down. And what they found is that in 1997, there was 192 million visits to the chiropractors. And it's continued to go up since then due to the effectiveness of chiropractic. Okay, so we've talked about how effective chiropractic can be and how it's going to work for you and how we're going to address the underlying causes of your back pain and not just mask the symptoms. Now, the next question that a lot of people were asking was, is chiropractic safe? Now, I want to show you this study here. Okay, this study came out in 2007, and they followed 19,722 patients who were adjusted a total of 50,276 times to determine the safety of chiropractic adjustments. And there were no reports of serious side effects, and there were 16 minor side effects per 1,000 adjustments. These side effects included lightheadedness, dizziness, and fainting. Now let's compare this with some of the more mainstream treatments for back pain. First of all, acetaminophen, leading cause of acute liver failure. NSAIDs and aspirins are associated with GI toxicity, bleeding ulcers, heart attacks, and kidney damages. So some pretty serious side effects there. Okay, another way to look at the safety of chiropractic is look at the cost of malpractice insurance. The typical chiropractor will pay between $1,500 and $3,000 a year for their malpractice insurance, in contrast to a medical doctor who will be paying between $22,000 and $175,000 a year for malpractice insurance. Well, thanks for joining me today with this webinar about back pain. I hope you've got a better understanding of some of the common causes of back pain. I hope you understand the typical treatments that are out there for back pain, why they're not effective, how they're not addressing the cause, the underlying condition that's there. And third, what I do to treat back pain and how that can really help you out. And I would like to remind you to download the coupon that's here. That's only available during the webinar. Thanks for your time. I'd love to address any of the questions that you guys have. Thank you.